We now have available to us in the field of movement disorders is called DatScan. Sometimes I refer to it as a dopamine brain scan. It actually provides an index of remaining dopamine neurons. It entails injection of a ligand or a binding medication into the vein, and it then travels up into the brain, and what it does is it binds to dopamine transporter or DAT sites on remaining dopamine neurons up in the brain. And if you have a full complement of dopamine neurons, we'll see a lot of binding of this medication. If you've lost a fair number of dopamine neurons, we'll see a reduction in the binding. And it turns out that when you have a full complement of dopamine neurons, we see these nice big commas that sort of look like this. If you lose dopamine neurons, you tend to lose them from the back forward, so you tend to see these round dots as opposed to these nice full comma-shaped images. Now, it's important to recognize a couple things. Number one, the DatScan is not 100%. I would say something like 95%, 97%, that's sort of a made-up number, but it just illustrates that it's not 100%. And these are read by visual interpretation, so not only is the test itself probably not 100%, you're also dependent on the interpretation by the reader. It does pay to make sure that your radiologist, your interpreter is experienced. The more experienced, probably the more reliable the interpretation. The other thing to recall or remember is that it really just talks, or the image really just reflects remaining dopamine neurons. And there are a number of entities in which one loses dopamine neurons. Parkinson's disease is one, but one also loses dopamine neurons in atypical Parkinsonisms, being multiple system atrophy, progressive supranuclear palsy, and others. So the DatScan doesn't differentiate between Parkinson's disease and atypical Parkinsonisms, other degenerative disorders in which one loses. So as a physician, if that's the question one is asking about a patient, is this Parkinson's disease or is it an atypical Parkinsonism, the DatScan will not be helpful. The DatScan does help differentiate disorders in which dopamine neurons are being lost from those in which dopamine neurons are not being lost. So what might those be? Well, it might be someone who is, quote, normal, an older individual who appears to be slow. Are they just slow from the aging process, or do they have underlying Parkinson's disease? Essential tremor is common in the differential diagnosis. These patients have tremor, and it may be difficult to tell if they have Parkinson's disease or essential tremor. In essential tremor, the DatScan should be normal. In addition, medications that block dopamine in the brain, these being neuroleptics, which block hallucinations, or anti-nauseants, can block dopamine and cause a picture that looks exactly like Parkinson's disease. And here, the dopamine neuron complement, the number of dopamine neurons, should be normal, so the DatScan we would expect to be normal. So DatScan can be very helpful differentiating Parkinson's disease from medication-induced Parkinsonism. And lastly, psychogenic or psychological causes of tremor and Parkinsonism, one would expect a normal DatScan. So remember, DatScan can be abnormal in several different kinds of neurodegenerative diseases. Parkinsonisms, both Parkinson's disease and atypicals, and it can be normal in healthy individuals, essential tremor, medication-induced Parkinsonism, and psychological conditions. The other thing I want to point out is that the vast majority of patients with Parkinson's disease don't require a DatScan. If the clinical diagnosis is clear, there's no reason to get a DatScan. So if there's asymmetry, slowness, stiffness, tremor, good response to dopaminergic medication, that patient clearly has Parkinson's disease, and there's no reason to get the DatScan. The DatScan is an additional tool to aid above and beyond the clinical evaluation in cases where the diagnosis is uncertain and you're trying to differentiate between conditions in which one may see loss of dopamine neurons and one may not see loss of dopamine neurons.